Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. Today's February 12th, 2021. Doing the weekly COVID update for the town of Falmouth, Mass. It's actually falmouthma.gov is our website. There's all the COVID stuff you would need on a COVID link once you click on that page. Our email is health@falmouthma.gov for non-vaccine related questions such as complaints, contact tracing and so forth. It's 508-495-7485. This is the County Health Department COVID hotline at 774-330-3001. This is also not for scheduling purposes at this point, and we'll talk a little bit that in a minute. So I'm going to start off talking about vaccines, and then we'll talk about cases like we did last week. Unfortunately, there's not a lot to tell you on a good note as far as the availability of vaccine. Things haven't changed since last week much. We're still at the individuals over 75, and anybody in phase 1 is still eligible. And so we're still at that point. Talking a little bit about registration. Right now, because there's not a lot of vaccines on the Cape, when clinics are stood up, meaning the states said, okay, here's vaccine for a clinic, they're taking 15, 20, 30 minutes to go. I mean, the 800 appointments are going like hotcakes. And it's very in short supply, and for what I've been told, it's still another couple of weeks or more for that. We're getting about 1,000 or so doses each week. A couple weeks ago, we did 600. The third, we did 600 at the fairgrounds. It's rotating over to, you might have heard that the Melody Tent had some. Next week will be Orleans. Until enough vaccines. I mean, we're prepared to run the fairgrounds on a daily basis, 5 days a week or whatever, based on the availability of doses. I think what will eventually happen is it will be weekly as doses come in a little bit more, and then more and more as more doses come out. So they are being, there's 3 existing and there's 1 being added on the Outer Cape. And there's more, again, the more vaccines we get, the more clinics we can run, okay? There's a 211 state registration number to register for vaccines. I'll talk about what it looks like in a second and where they are. In the town, we're also setting up a way that residents can register if they do not have any ability to go on the computer, don't have an internet access and so forth. Because what's happening is it's sort of unfair. The ones that are quicker on the trigger with the vaccination, with their computer or their phones, are able to register quicker than those that aren't, and that needs to be worked out. So that's where we are with that. So we'll post that number once it's all set up. But right now, there's not a lot of vaccine, not a lot of appointments to give, and so it's really tough right now. When you go on the states.gov vaccine locations, you come up with this map, and I just want to show you what the map's about. The red stars are state vaccination sites. There's currently one at Gillette. They're also putting one in Dartmouth. I don't believe they're going to put one on the Cape at this point. So those might be the 2 closest. There's also private sectors, like CVS came in and East Falmouth came online. They'll be represented by blue stars. The gold stars are the regional clinics at the county, which is the fairgrounds, the Melody Tent, Orleans DPW, and then there's going to be one on one of the seashore parking lots in the not too distant future. And so those are going to be the 4 sites that will be doing vaccinations. And again, we could be running each one of those simultaneously if we get the doses. So we're just going to get the doses. So you should, if you haven't had a chance to go through it and you are computer savvy, you would work on this. And the clinics do pop in and out. I'll show you what it looks like in a minute. And the state has said that more stars will pop up as more availability comes, especially with the pharmacies and the private sector. How we're going to work it in Falmouth, ideally, once we get the vaccines, is not only we'll have the regional, but we could also be able to funnel off some of those and do some of the vaccines and work on Falmouth-only focused clinics like at the high school. So we would work our way to even regional and local ones. It's just right now a matter of not having the vaccine to even do the regional clinic on a routine basis, never mind going into the high school and doing another clinic on top of it. In tandem with that, we have people that are homebound and other vulnerable populations, and the VNA will be doing ordering for it will be, when vaccine becomes more available, would be able to get vaccine to do those sort of fine-tuning type of vaccinations. So we'll have both avenues available to us to work on both those that are difficult to get to, can't get to a clinic, and so forth. But just keep checking on the site. I believe just about now, around 12 o'clock, that we do this on Friday. I think the Orleans one is opening up. The 800 that are in Orleans will go in very, very short order. And that's just the way it is right now, and it will be probably for the next couple of weeks. I don't see a new fairground clinic for new vaccines coming up in the next couple of weeks just because of the shortage. There will be one for the second round doses for the ones that had it on the third. But as far as having new clinics, again, it's about just running the clinics, rotating each week until more vaccine shows up. It doesn't make sense to, you may be asking, why don't we do 200, 200, 200? Well, 200 takes about an hour and a half, and you have to set it all up. So it just seems to make more sense to sort of float them from different sites to make it a little bit more convenient for each parts of the Barnstable County, just because of the lack of quantity of vaccines. When you click on the gold star, this is the Barnstable County one. It'll have this website that says maimmunizations.org, and this is what you would click on to register. CVS's and the private pharmacies will have their own look to their websites, and you'll have to register with them. But this is the main one that the state website, the state sites, and also the regional sites that we have are linked up through massimmunizations.org. It looks like this when you open it up. The fairgrounds show up. This blue sign up for vaccination goes on and off based on whether there's availability. You search by Falmouth, you click on vaccination, adults, seniors, and search. You can put the fairgrounds in there, and it would come up. Problem is that there isn't any vaccines to show on this, but which stinks relatively, quite honest with you. Prep mod. When you do go, if you did that same search now, you would come up with Gillette Stadium. The state's putting most of their vaccines into their state-run clinics. If you can get to Gillette, there's been appointments at Gillette, and it hasn't been a problem to get up to Gillette. But it is an hour, slightly over an hour to get there. But that's what the state's doing with the vaccines. They're putting a lot of their vaccines into these state-run clinics, and which puts us at a bit disadvantage because it's a little bit of a ride, to say the least, especially for some, and especially when we're dealing with 75 and older. But that's where the vaccines are right now. The fairground site, if you do get a chance to get to it, eventually, as the vaccines come in, we'll have this running a lot more. You would enter in a courier road. The attendant would see if you have an appointment. If you don't, again, this is by appointment only. It's not just the first 600 cars to show up. Otherwise, 151 would be a horror show. It's by appointment. If not, we send you back out. If you do, you go into the barn. There's going to be 6 vaccinators, so 6 cars are done at once. Down here at a holding, then out Shumet Road, either left or right, whether you're going towards Mashpee or going back into its Falmouth, we're born. So the clinic ran pretty smoothly. We did a little over 600 doses in 5 hours, so we have a pretty good throughput on that. But what we need to do is run it a lot more often once vaccines come in, and that's just all we're waiting for. This comes from the state site. It shows that the amount of doses shipped based on population. So to date, the ship's 11.5 to Barnstable County. That would be a lot of your first responders, healthcare workers. We do have a lot of healthcare here. We do have a lot of long-term care, and that's where the vast majority of the percentages are. It doesn't break it down by age, by sector in this particular slide. You can see that most of them, almost half, has been in Suffolk County. And so that's where the distribution has gone. For example, Martha's Vineyard's got a higher amount than that. We don't have any control over that, so when vaccines do go, that number will increase quite quickly. Total doses, Barnstable seen 24,875, again, with the vast majority of that going to Cape Cod Healthcare and different sectors that did the first responder clinics and the Cape Cod Healthcares and the long-term care, partnerships with the pharmacies that did a lot of their long-term care, so the vast majority of that would be with phase 1. You can see other counties. Now, again, Essex, Middlesex, and Suffolk counties have seen a lot higher rates of disease, and perhaps the reason why the state is focusing on those areas with higher rates. We've done fairly well we've done better than those, definitely better than those particular counties. And so I think that's why the doses are sort of flowing in that direction. So that's it for vaccines. You're just going to have to keep patient, like I said last week. As more and more vaccine comes available, more and more of those clinics will open up. Ideally, you should be able to click on an open clinic and be able to book a week or so in advance, or book, and be able to do it. But right now, it's just 800 doses. We do an 800 dose clinic. They're gone in 30 minutes, 20 minutes. It's really quick. And we're looking at, and that's the state system, the online registration system. We're hoping to be able to be in a better shape shortly as the vaccines come in. And so that's it for vaccines. Talk about cases. We've had a good week, so, not a good conversation or a good presentation for the amount of doses available. We'll talk about cases now. 1,119 cases since the beginning, with 14 probable since the beginning of this month. There were 25 over the past week, which is way down from 110, 80-something, down to 47, and down to 25. So we've done well from a case standpoint. About 92% of the cases are no longer in isolation. We're down to under 12% of all cases in Barnstable County, when 14 would be the average. So we've had we're doing better than the rest of the county, at least with our caseload. And the VNA, the CTC, Health Department, we still do our thing with contact tracing. So you can see here in the chart, represented by each week being represented by a dot or circle. You can see that we were at a peak at the end of late January of 110, dropped down to around 82, 83, down to 47, down to 25. So that's a great trend to have. I'm glad to see it. If we can get down to where we were in the fall, that's really good for this time of year with people being indoors, and this generally being the highest risks time of year as opposed to the summer. So I think we're doing well on the case end, at least the past couple of weeks. You can see a slight flattening. This is the curve that just shows you each case, the case total number of cumulative cases over time. The flatter it is means the less cases that are popping in. You can see where it got really heavy over in the December, January. You can see there's a slight flattening. Hopefully we can keep flattening that out and have it look more like we saw in this from June to about November. Cases, again, whether you're considered a yellow community, red community, green community, it's got to do with cases. Based on our population, 43 or more would bring you to yellow or red, and then based on its percent positivity, which is the total number of tests taken and the total number of positives, is if it's less than 5%, you would stay yellow. If it's greater than 5%, you would be red. So after having a couple of weeks of red at the end of January, we've been 2 consecutive weeks of yellow. Our percent positivity was the highest at 5.81 back in the 21st of January. Within 3 weeks, we've been able to bring it to 3.16. Anything less than 2 is considered pretty good. 3, again, losing almost a whole percentage point in positivity is great. The trends are in the right direction, and it's actually earlier than I would have originally thought. We've been able to do a good job. Let's just hope we keep it that way. Our percent positivity compared to Barnstable is the county of Barnstable is over 2% lower for the week. For the 2-week time frame. This data goes up until 2/9, so it goes up to the 9th of February. That's when the state cuts this off. And according to the state's actually in yellow after being a long time in red, where they're at 3.4% positivity. So we're better than the state, definitely better than the county right now, and so that's kind of where we are. And so we're yellow. Barnstable County, you can see that's sort of been drop off with that peak in that sort of January period with the 400s. Dropping down into the hundreds for that. So we're in the right direction in the county, and Falmouth doing even better than that. As far as the cases, this is the daily dashboard. I have down arrows everywhere, which is what you want to see. So we're averaging around that 200 to 2,500 cases per day, which is down from maybe the 6,000 plus we were seeing. Averaging between 75 and 110,000 tests per day is great. Percent positivity for that 7-day period is actually really low at 2.6, way lower than what we've been seeing. Hospitalizations are down, ICU and intubations are down. So that's all good news on the state level. So we're tracking in the right direction on that. So really what we need is more vaccines. As this drops in more vaccines, it would be in really good shape. All the trends, the graphs of the different show all the drops at the end, showing that all our metrics are doing better for the state. Again, you can see this every day on the daily dashboard, which comes out about 5 o'clock. Barnstable County hospitalizations, you can see on 210, the last data I have is Falmouth Hospital had 4 beds, 1 in ICU, 4 hospital beds. Cape Cod Hospital was 22 and 8. So you can see that back, at the wave 2 peak, we were having it right around 10 and 5. We're at 4 and 1 now. So again, less cases, less hospitalizations, less ICU, less death. So that's again a good trend. Testing hasn't changed. Falmouth Hospital by appointment, like it's always been. CVS, Community Health Center of Cape Cod, the walk-in clinics at Convenient MD are still doing their thing. Barnstable County's Fairgrounds is also doing it. That's no charge on that one. You can call the community testing line at 508-534-7103. You really should go through your physician first, but that can be. They're running that through the fairgrounds, but that's not an everyday occurrence. So if you can get an appointment for that, that works for you. If not, then you've got Convenient MD and CVS has done a lot of testing in Falmouth, and thank them for that. So you can still do that. Again, talking about diligence, keep on doing the things that you do to keep yourself safe, meaning staying home when ill, self-isolate until you get tested, social distancing, face coverings. CDC had some new information on face coverings. Get a good face covering. They're talking about 2 face coverings as well, but just good face coverings. You know, a handkerchief or a bandana is not really a good face covering. Just have a good face covering. Hand washing, hand sanitizing is still important. Travel's important. Quarantine upon arrival. Next week is school vacation week, and so we're hoping we don't see an increase, a week or to 3 after school vacation week. So, we're urging people not to travel, though we know that's going to happen. So it's making sure that you're doing everything to protect yourself and also to protect the schools by not just ignoring the guidance and just sort of coming into school after a week, after being gone for a week, and not getting tested and not doing the things that you need to do. Obviously, the gatherings, the parties, the indoors and outdoors, the lack of social distance, what a lot of your cases come from. And each sector specific has guidance, like places of worship, workplaces, gatherings, and sports. That guidance is still there, easily to get to at the mass.gov. Follow the guidance. If you've got questions about guidance, you can call the health department or email us. So as a recap, state metrics show a decrease in cases, percent positivity and hospitalization. Falmouth remains yellow and had a 47% reduction from previous week. Be careful, during school vacation week. There is still community spread around. Regionally, the vaccine is being administered as it arrives, and the supply should be getting better. The vast majority of vaccine is being sent to the state sites at this time. If you can get to a state site, you can get an appointment and you can get vaccinated. You're going to need to go back to that same site because that's where the second dose is going to go back to. You would get you would do it that way. So you need to go up there twice. If you can get there or have somebody bring you there, a family member or friend or somebody, then that would be the way to go at this point. Otherwise, you would have to hang tight for a bit until we get plenty of vaccines, and we're running the Barnstable Fairgrounds for 2, 3, at least once a week, twice a week, whatever we get enough vaccine to do it. So we have plans. We're ready to vaccinate. What we're missing is the vaccine. So that's the update for this week. I'll see everybody next week. Hopefully I have better news on the vaccine front, but only time will tell. Thanks.